Before the mid-1990s, Michigan healthcare professionals were at great risk if they attempted to get help for chemical dependence or other impairments. The Health Professional Recovery Program, or HPRP, was established by legislation in 1993. This confidential program is designed to encourage health professionals to seek treatment before their impairment harms a patient or damages their careers through disciplinary or regulatory action. It is administered by a private sector contractor under the direction of the Bureau of Health Professions in the Department of Community Health. HPRP offers monitoring for most of Michigan's licensed healthcare professionals, including dentists and members of their team. Monitoring allows the newly recovering dentist or team member to continue to practice while maintaining safety for their patients. The monitoring agreement also allows the newly recovering professional the chance to avoid sanctions against their license. A monitoring contract is a set of rules and conditions that the newly recovering professional agrees to follow for a period of time, usually 3 years or more. Some of these conditions are random drug testing, HPRP-administered group therapy sessions, monthly reports to HPRP, quarterly visits to a certified addiction medicine specialist, and required attendance at 12-step groups like Alcoholics Anonymous or Narcotics Anonymous. Most professionals are referred to HPRP for monitoring prior to or during drug and alcohol treatment. It's typical for a dentist or team member to have a monitoring contract in place before returning to work after treatment. Now, let's take a look at the HPRP process. This is a flowchart representing how HPRP works with the monitored health professional. In the upper right-hand corner, we see that licensees can be referred to the HPRP system in a variety of ways. The Michigan Dental Association has directed many impaired dental team members to the HPRP. Once referred to HPRP, the potential licensee goes through the HPRP intake system and is sent for evaluation by addiction medicine specialists. This evaluation will help determine if the professional is eligible for HPRP. If they are, they're usually directed to go through some kind of treatment program. If the professional doesn't consent to treatment after being told they need treatment, the case is referred to the Department of Community Health for investigation. In other words, not good. If the professional consents to treatment, they are directed to keep in contact with HPRP through the treatment process so that an HPRP monitoring contract can be crafted. Once on contract, the HPRP monitors the licensee's compliance to the contract. If the licensee remains compliant throughout the contract, then they complete HPRP with no consequent referral to the Department of Community Health. This is very good. Relapse is often a part of chemical dependence, and the HPRP has provisions for a professional who suffers this setback. If the licensee chooses to get back on board, they can be given another chance with an adjusted recovery monitoring contract, and monitoring can continue. If the relapse is destructive, or the professional chooses not to get back to the HPRP, their case will be sent to the Department of Community Health for investigation. As you can see, the state of Michigan has a forward-thinking solution for professionals that have chemical dependence issues. The HPRP continues to safeguard the public while allowing healthcare professionals to continue to thrive in their chosen professions. If you would like more information about the Michigan Health Professionals Recovery Program, you can find it on their website at hprp.org. If you have any questions or comments about this presentation, please feel free to email me at info@mapsinformation.com. Thank you.